Good evening, everybody. My name is Rhea. I'm the Director of Health and Fitness at the Reh-Fit Center, and we're very happy to have you to our Fit Talk series. Tonight, the topic is Don't Forget Your Balance. Sure to be an excellent talk. Quite excited to hear all the wonderful things that we're going to learn and all the interesting stuff that we can apply tomorrow with all the new information that we learned tonight. Again, a reminder to mute your mic and turn your camera on if you like to be seen, and use the chat box on the bottom. And we will get going right away. I'm going to keep letting people in as I pass it over to our presenter, Sandra Webber. You can maybe do a bit of an intro and I will manage the weight room.
All right. Thanks very much for that introduction, Rhea. I'd like to thank the folks at the Reh-Fit for inviting me to talk tonight and to thank all of you for attending. As Rhea said, my name is Sandra Webber, and I'm a physiotherapist and associate professor at the University of Manitoba in the Department of Physical Therapy at the College of Rehabilitation Sciences. I know that's a bit of a mouthful. I'm going to be talking to you tonight about balance, why it's important, what body systems are involved, and how to ensure that you're including some balance work in your exercise sessions. Now that the weather's getting warmer and our days are getting a bit longer, I know that people are interested in getting back to more physical activity outdoors, like walking, gardening, riding their bikes, maybe even paddling a canoe, etc. And while the winter definitely presents challenges for our balance, some of these outdoor activities that we do in summer can also challenge our balance more than our typical indoor activities. So why is balance important? Well, I think we would all agree that we need a certain degree of balance in order to carry out our normal activities and to deal with unexpected circumstances that arise as we move about in our world. The level of balance we require in our everyday lives depends a bit on what our normal activities entail. People who are professional athletes typically require high levels of strength and balance, but more mundane tasks such as negotiating uneven or icy terrain can also require high levels of balance. Sometimes you need good balance to ride in a bus, especially if you're standing up while it's moving. Balance is also important to prevent falls. Almost 1/3 of adults 65 years of age and older who live independently report experiencing a fall in the past year, and the percentage of falls that result in serious injuries tends to increase as people get older. Is it only older adults who need to think about their balance? Well, no, having good balance is important for everyone. It's not only older adults who need to think about their balance or about monitoring and training the body systems important for maintaining good balance. All of us experience balance challenges regularly in our daily lives. Having said that, the main things that I'm aiming to cover in this talk include reviewing the meaning of the term balance, discussing the systems of the body that are important for allowing us to maintain our balance. I'll talk about exercise and explain a little bit about what the research suggests for improving or maintaining balance, and cover some specific information about ways to challenge balance and make sure that you're including effective balance challenges in your exercise or daily physical activity. So what do we really mean when we talk about balance? How can we tell if someone has good balance or trouble with their balance? Balance is defined as the ability to maintain the center of mass over the base of support. The center of mass is the point at the center of our total body mass. For most people, the center of mass is usually in their abdominal region, and the position of the center of mass doesn't change unless people change their body shape substantially. The base of support, on the other hand, can be changed very easily. If we draw a circle around all points of our body that are in contact with the ground, then we can determine our base of support. So when we have our feet placed relatively close together, as shown in the person with the red circle around their feet on the slide, then our base of support is relatively small. And if we stand with our feet wider apart, like the person with the blue circle, then the base of support is larger. And if we stand with our feet in different positions, for example, like the woman on the right who's doing a lunge, then the base of support changes again. And in this case, the base of support would be relatively long and narrow, the area between her 2 feet. Balance reflects our ability to keep our center of mass, which, as I said, is usually in the abdominal region, over top of our base of support. If our center of mass moves outside of our base of support, for example, as occurs when we move our trunk forward when we're walking, then we need to make some kind of corrective action to bring our base of support back underneath the center of gravity. And we do that by finishing each step when we're walking. If we're not able to do that, that's when we run into trouble and can lose our balance. All right, so now that we have some idea of what we're needing to achieve in order to maintain our balance, what systems of the body play an important role in allowing us to do this? Maintaining balance requires integration of feedback from our visual system, our vestibular system in the inner ear, and our somatosensory system, which you can think of as sensory receptors located in our skin, muscles, and joints. These are the kind of receptors that allow us to sense touch, pain, and temperature, and be aware of the position of our joints in space. Whenever we experience a threat to our balance, we have to receive that information from our environment and process it very quickly in order to generate an appropriate movement strategy to avoid a fall. So you can see there's a lot going on here, and we need to be able to react within a few hundred milliseconds, or we might find ourselves unexpectedly on the ground. This means that there are a number of factors that should be considered if someone's having trouble with their balance. We need to consider and determine whether the type of problem they're demonstrating might be related to problems with their vision, or whether they could have a vestibular disorder. We also need to consider whether they're getting accurate information from the sensory receptors in their skin and limbs, and whether their levels of strength and flexibility are adequate for the movements they need to be able to make. As I just mentioned, strength and flexibility are important in determining whether a person is going to be able to generate the appropriate movement and to generate it fast enough in order to prevent a fall if they experience something that disturbs their balance. For example, when we're walking and if we catch our toe, we need to generate a fast and forceful movement with the trunk and the hip in order to get our leg in front of us to prevent a fall. For these reasons, it's important to maintain strength, muscle flexibility, and joint range of motion as we get older. Medical conditions and certain medications can also affect balance. We already mentioned that the vestibular system in the inner ear provides vital information needed for maintaining balance. So anything that interferes with normal vestibular function will have serious effects on balance. The same goes for our vision, because our eyes provide a lot of feedback that we use for balance. Peripheral neuropathy affects sensation in the extremities, so in our hands and feet, which means that individuals may not receive normal cues. For example, when they're walking on uneven ground, they might not be aware of that. Diseases that affect the neuromuscular system, such as Parkinson's, multiple sclerosis, and stroke, can have significant negative effects on balance. People with arthritis may lack strength and joint range of motion in order to react with enough force and speed to prevent a fall. And people who have arthritic changes in their necks can have difficulty if they need to look behind them. For example, if they're walking and they're checking behind them. In order to do this, if their neck doesn't move very well, they might have to bend and twist their trunk. And when they do that, they move their center of mass outside of their base of support, which makes them vulnerable to falls. Cardiovascular conditions such as low blood pressure and irregular heartbeats can result in dizziness and put people at risk. Cognitive impairment and dementia affect attention, reaction time, decision-making, detection of postural cues, and short-term memory. And all of these things are important in allowing us to be able to receive and act on information related to movement in our environment in a safe and efficient way. Some medications taken on their own or in combination with other medications can also affect balance. And if they have the potential to negatively affect blood pressure, the level of alertness, or blood sugar, then they can definitely affect your balance. It's important that people taking medications discuss the side effects with their doctor or their pharmacist and be alert for any changes in balance. I expect that many of the people listening in tonight are familiar with Canada's 24-hour movement guidelines. Recommendations for physical activity for adults 18 to 64 years of age are to try to accumulate 150 minutes of moderate to vigorous aerobic activity, like walking, cycling, or swimming, every week, and to do some muscle strengthening exercises at least twice a week. In terms of physical activity, the guidelines are the same for adults 65 years of age and older, except that it's also recommended that these people engage in physical activities that challenge balance. While I appreciate that this recommendation is included here for older adults, I think we could also include it in the guidelines for all adults. And the way that it's written doesn't provide much concrete guidance for people to know what this means. What are physical activities that challenge balance? And how often do you need to do these types of activities? There's a fair amount of evidence supporting exercise as an intervention that helps prevent falls in older adults. This area has actually received a lot of attention, and over the past 20 to 30 years, more than 300 randomized controlled trials have been conducted around the world. A randomized controlled trial is considered to provide the highest level of evidence for exercise interventions. It's a research study where participants are randomly assigned to one of two or more groups. One group receives the treatment, for example, a specific exercise program, and the other group or groups, called the control or comparison groups, receive an alternative treatment. The people evaluating the outcomes usually don't know which group each participant belonged to, which removes or at least reduces bias in conducting their assessments. Tricot and colleagues, a group of researchers from Canada, published an important paper in 2017. In their study, they reviewed all randomized controlled trials published between 1990 and 2017 that evaluated fall prevention programs in older adults. In total, their analyses included 54 randomized controlled trials, and they were able to combine the data from all of these studies so that their evaluation included almost 42,000 people. Findings indicated that a combination of exercise and vision assessment and treatment, so doing exercise and also getting your vision evaluated regularly and wearing glasses if you need them, was the most effective intervention for preventing falls that resulted in injuries. They also determined that exercise by itself, without the vision assessment and treatment, was effective, but not quite as powerful as when the two things happened together. This is a significant study because it was able to combine so much data from a large number of smaller studies. Sherrington and colleagues, a group of researchers from Australia, also published a systematic review in 2017. In their study, they evaluated trials in which older adults were randomized to receive exercise by itself compared to a control group. So they specifically looked at the effect of exercise interventions, whereas the last group of researchers that I spoke about looked at exercise, but they also looked at vision evaluation, environmental assessment and modification, and calcium and vitamin D supplementation. Sherrington et al. Found 88 randomized controlled trials that fit their criteria, and combining these trials resulted in almost 20,000 participants. They determined that exercise reduced the rate of falls in community-dwelling older adults by 21%, with greater effects when exercise programs challenged balance and involved more than 3 hours per week of exercise. The take-home messages from this large-scale study are that exercises need to provide a high challenge to balance in order to be effective, and that people need to do activities that challenge their balance for 3 hours per week and keep it up. The authors also recommended walking and strength training be performed in addition to balance training, but not instead of balance training. They found that programs that involved less than 3 hours of balance work each week did not have a significant effect on reducing falls. So what does it mean to challenge your balance? Well, basically, you should have to think about maintaining your balance. If you're not having to particularly focus on your balance and you're not having any trouble keeping your balance, then you're probably not challenging your balance. If it seems easy, it probably is easy, which means that the activity isn't really helping you to improve your balance. There are a number of different things we can do to make it more difficult to maintain balance. First off, we can reduce our base of support. So this means, it could mean standing with our feet right together, like this guy in the black clothes on the slide here, or standing with one foot directly in front of the other, or standing on one foot, like the lady on the left is doing. We can move our center of gravity towards the outer limits of our base of support by reaching or stepping. And we can combine those types of activities if we do some reaching or moving our trunk while we stand on one foot, for example. So the person at the top of the slide here, the black outline shows a relatively very difficult exercise where the person is standing on one foot and bending the trunk forward and extending one leg behind them. Another way that we can challenge our balance is to change the surface that we're standing on. So we could stand on a compliant surface like a foam pad, which the person on the bottom left is standing on that blue foam pad, or stand on a cushion from a couch to make things more difficult. Walking on a gym mat, or doing plank on a stability ball, or doing squats on a Bosu ball that we can see on the slide here are examples of exercises that challenge our visual and vestibular systems to help us maintain our balance. A third way that we can challenge our balance is by taking away our visual input. So if we close our eyes while doing any exercise, or even just standing still with 2 feet together, like the man in the black shorts and t-shirt is doing here, then that will challenge our balance more than if we keep our eyes open. And if we add a cognitive task while we're trying to maintain our balance, that also makes things more difficult. Maintaining a conversation or counting backwards from 100 by sevens. So example, going 100, 93, 86, 79, or figuring out how to spell some words backwards are examples of cognitive tasks that people can use to try to make it a little harder to keep their balance. Of course, these types of distractions also happen in real life all the time. Walking and talking on the phone at the same time, or checking for traffic while you're trying to quickly cross a street are examples. I want to stress that in addition to improving our balance, so that we can hopefully avoid unexpectedly finding our center of gravity outside the base of support, it's also important to work on muscle strength, flexibility, and power, or the ability to generate force quickly. If we do lose our balance, then these are the systems that need to kick in to help us get an arm out or a foot down to break our fall or prevent a fall. I wanted to share with you one more research study tonight. This one was conducted by Lindy Clemson and her group in Australia. They did a randomized controlled trial and it was published in 2012. There were 3 groups in the experiment. One group performed structured, standardized balance and lower extremity strengthening exercises at home 3 times a week. One group did gentle flexibility exercises at home, and one group was taught what they referred to as lifestyle integrated functional exercise, or life exercises. Older adults in this group were specifically taught how to reduce their base of support, how to move to the limits of sway, and how to do strengthening exercises as they went about their everyday routine. And they were encouraged to integrate these types of exercises multiple times every hour during their day. For example, they tried to do a tandem stand or a one-legged stand if they were working at the counter in the kitchen. And they tried to do some squats or toe-ups whenever they got up from sitting. In short, the training aimed to change habitual behaviors, to incorporate balance challenges and strengthening challenges frequently each day. The participants did 9 sessions spread out over 6 months. So the training wasn't particularly one-on-one intensive, but it was reinforced regularly. And they were challenged to try to keep track of what they did each day on a regular basis. After 6 months, the results showed that the group in this LIFE program improved both their static and dynamic balance, beyond the levels shown in the participants who did the standard exercises 3 times a week. The life participants also had fewer falls over the following 12 months. This is an interesting study because it demonstrates one way that it might be possible to actually try to achieve those 300 minutes of balance training each week, rather than simply doing balance work during specific times that are designated for exercise. They can be incorporated into everyday life. If you're looking for some help with incorporating more balance work in your exercise routine, there are a number of options available. If you're a member at Reh-Fit, you can obviously seek help from the exercise professionals there. They have specific balance classes that you can attend, personal training, and physiotherapy on site. For anyone who's having trouble with their balance or experiencing falls, then I recommend that you see a physiotherapist and get your balance and strength assessed. You should also make sure that you see your doctor and get your eyes tested regularly. The important thing is to try to figure out what the right level of challenge is for you if you're trying to do some balance work. Exercises shouldn't be easy, but they also shouldn't be so difficult that you might lose your balance and fall. We're living in very different times right now, and it's hard to know what's coming next. While some things and some places are opening up again, everything is definitely not back to normal. The links on this slide are examples of online balance training videos that people can access if they prefer to exercise at home. Again, I don't recommend this for people who are having significant difficulty with their balance. The best option in that case would be to see a physiotherapist for an in-person assessment and then determine appropriate exercises to do at home, if that's what the person prefers to do. The first link here is for a class with Jen from the Reh-Fit, and then I've included a link for a balance session produced out of Sunnybrook Hospital in Toronto, and another from the Toronto Rehab Institute. There's always some tension between finding movements that are safe to perform and yet still effective. Remember that in order to have a substantial effect on balance, the movements need to be challenging, and you need to spend a lot of time working on balance, either through traditional exercises or by incorporating balance challenges and strengthening exercises into your daily routine. Whenever a person is trying balance exercises in standing, it's important to wear good shoes, clear the area of potential hazards on the floor, and to stand close by to a sturdy surface like a kitchen counter, in case they need to grab onto something to steady themselves. I hope that you now have a little better idea about the importance of the visual, vestibular, somatosensory, and neuromuscular systems, and that the way that they all contribute to balance. Hopefully, you've also come up with a few ideas of ways that you can challenge your balance and keep working on exercises that address balance. You're all likely already challenging balance in some of your daily routines, whether that involves putting things away in a high kitchen cabinet where you have to reach up on one foot, putting your socks on while you try to stand on one foot, or doing difficult strengthening exercises on a BOSU or stability ball. Maybe you can think about adding a few new challenges to your routine. Balance is something we should all work on throughout our lives so that we're less likely to be caught off guard and our bodies are able to react to protect us when we need it. That's about all I have to say. Thanks for coming to the talk tonight, and I think we're probably ready now to open up for questions or some discussion.
Thanks, Sandra. That was great. I have one question actually in it, and you said it in your presentation, and then I'm looking at some of the pictures. So you mentioned when you're wanting to train some of your balance, you should have good shoes. What's your kind of thought on training your balance in bare feet? So typically we don't wear shoes in home. So if you're walking from point A to point B and stuff, is there a different way you should train your balance? Is it the same way, but just shoes provide a little different support, or what's the thought on that?
Well, it's true that the shoes provide a little bit of support, but honestly, my main concern is just protecting your feet. So if you're confident that wherever you're going to do your exercises is safe and that the floor is, that there's nothing on the floor that might scrape your foot, then, which is, pretty common. If you're in your own home, you have a good idea of what's going on. So as long as you have decent grip on the floor, then you would be okay. So I would recommend that if you're not going to wear shoes, that bare feet is a better option. We wouldn't suggest that you try slippers or socks on your feet. So either have a good grippy shoe or a bare foot on a safe floor.
Right. So if you're at the center, right, you need to wear shoes and socks. That's kind of for safety parameters. But again, if you're in your home, just to reiterate that, and your floor area is safe, that you probably could do some balance exercises, with your countertop or at your bathroom sink or your kitchen sink on a barefoot with bare feet. So that's great. If anybody else has any comments, or questions, you can put them in the chat box. We're probably all trying to think of interesting ways that we can challenge our balance, maybe later today or tonight, or as the days go on, things that we do outside, what can we do differently? And there's always kind of if you have any young kids that you can run around with or just watch how they play, you'll definitely pick up some tips on different ways of working on your balance that just comes second nature to them. So I learn it firsthand from my daughters all the time, and I'm like, how do you do that? So that's always fun and great learning. Can you please repeat the resources available online? Someone's asking if you can just flip back, I guess, a slide or two to that.
There we go.
Yeah, thanks. So those are a couple from Toronto, like she said, and one is from the Reh-Fit, the balance series with Jen. And again, there's other balance type classes on our Reh-Fit at home page. So you can scroll through the classes that we have offered there. And there's usually a balance component that they make part of most of the fitness classes that we offer. So if you're just starting out and you want to get an idea of what some of those exercises are like, probably can try any of the classes that we have. You guys can jot those down, or you can take a screenshot of them and then see what great information we get from that. If anybody else has any other questions, again, you can put it in the chat box. Give everybody a couple minutes if there's something. If not, it's always just nice to hear that you're at the talk and how you've enjoyed the talk. While I have this time before people start typing, we'll just highlight that next week, Tuesday, is our next presentation, March 30th. And it's with Christine Frederich. I'm going to say that long. But we're going to be looking at the physical activity, sedentary behavior across the cancer continuum. So more evidence and guidelines in terms of exercise and cancer and sedentary behavior. So that's next week's Tuesday's talk. If you're interested and want to participate, again, it's 7 o'clock through our Zoom link. Jan saying thanks for a great presentation. She's one of our faithful watchers, so thanks, Jan, for that. And again, if you have any other questions about balance, you could pass them on to me at a later date. You can leave a question on our Facebook, as this is a Facebook Live event, or you can come see me at the center or email me. And if they don't get to now, I will try and pass them on. Hang on, someone's raising a hand. Not sure how that works. Go ahead, Barbara. I'm just trying to unmute you.
I got myself unmuted. I just wanted to thank you very much for this talk. I found it very helpful. And I didn't realize we needed that much active balance exercise. So I'll try and incorporate some of that into my daily life. Besides walking on curbs, that's one of the things I do. Okay, thank you.
Yeah, thanks for that comment, Barbara. I think you're right that, 300 minutes a week, it sounds like a huge amount, and it honestly is a huge amount of time. But anything more than probably what your usual is going to be a good start. It'll be a little bit extra challenge for your body, and that's moving in the right direction anyway.
Yes, thank you.
Someone asked, I'm just going to make this larger. If you have a brain injury and have been challenged, he says he has a brain injury, he's been challenging himself with yoga and walking and other stuff to improve balance. I've improved I have improved, but it seems to it'd be leveled out, I guess, like a plateau. Is there anything further that they can do?
Well, again, I presume that you've probably been involved with some therapists along the way with your rehab. And I guess one question I would have is, how recently have you seen a therapist to get an assessment? There might be some safe exercises that are more challenging for you and that would be appropriate now that maybe weren't appropriate for you, a year or two ago. So it is possible that things could get better, but it really also depends on the type of injury and which systems are affected by that. So it's a little bit of a hard question to answer. It really depends, but if you're interested in trying to get your balance better because there are things that you're not able to do that the way that you would like to, or if you're having falls, then I would really recommend that you see a physiotherapist. Make sure that the person is comfortable assessing balance. We have some very well-known standardized tests that give us a really good idea of when we do the test. We put you through a bunch of things that take about 15 or 20 minutes to do, and then the answers that we get from that give us a really good idea of the types of things that you might have difficulty with in your everyday life and really point us in the right direction to the right level of challenge for you.
Great. Thanks, Sandra. Another just comment saying glad to listen. So I'll give everybody a minute or two, and then I think what we'll do is call an end to our evening tonight. Appreciate everybody for coming out. Thank you again, Sandra, for taking the time to share with us all this great information about balance. Again, you can go to our Reh-Fit website if you're not back at the center yet and try some of the classes. If you are coming, you can talk to some of our staff and they can hopefully direct you in the right way or provide you with some exercises to challenge you a little bit more. So I'm anticipating seeing everybody kind of standing on one foot tomorrow to see that they're all working on their balance. We'll see how many take it to heart, and we'll see.
At their counters, yeah.
Yeah, exactly. Thanks again, Sandra, and thanks everybody for joining us tonight.
Can I ask a question, please?
Sure, Shirley, go ahead.
Okay, I was just wondering if Tai Chi is a good exercise, a program to help with balance.
Yes, in general, the research is pretty positive for Tai Chi and for yoga. Those are just general statements. It depends, exactly what movements you're doing in your Tai Chi class or in your yoga class. But if you feel like some of the movements are difficult for you to keep your balance, if you feel like you really have to think about things and maybe, focus your vision on something in order to help you keep the movement, then those are the types of exercises you want to do.
Okay, that sounds good. And how about resistance training? Is the resistance good for you, the bands and that?
It's good for you. It doesn't specifically usually work on balance, but it works on strength. And we need to have good strength and we need to be able to move fast in order to protect ourselves if we do happen to lose our balance. So we need good balance, but we also need good strength. So they do go together. And if you're using bands, that can make it more difficult for you to hold your balance. So for example, if you're doing an exercise with bands with your arms, and if you're trying to do that while you're standing on one foot, then you're going to start bringing in, your core muscles working and making it a lot harder for you to maintain your balance. So you can do combination exercises where you get benefits for strength and balance at the same time.
Okay, thank you very much.
Thanks, Shirley. Okay, we'll give everybody a second or two if there's any kind of last minute burning questions. Otherwise, I will say good evening to Sandra and thanks again, and good evening to all of you for joining our Fit Talk. And I hope to see all of you out next week, Tuesday, for another great evening. Thank you, everybody. Good night.
Thanks for coming, everybody.
Thanks.
All right, bye.